On air, online, and on your radio dial, 98.7.
It's the new style. I'm playing with you.
It is New Style Radio 98.7 FM. Good morning, welcome. My name is JG Fresh, covering. I'm not supposed to be here, to be honest. Our station manager, Soccer Master, is supposed to be in the studio, but he's not feeling too well, as you can imagine, with all that is going on at the moment. And also Sister Amalia, hopefully you're all well. She was supposed to come into the studio as well to talk about this. You know, what's going on. I've got Dr. Justin Varney in the studio with me. Good morning.
Good morning.
Thank you for joining me. Oh, I've been going up and down the stairs. You gotta forgive me. I gotta get my breath back. And also Councillor Hamilton. Good morning. Hello? Councillor Hamilton? Oh, she's not there. I think she's gone. Hopefully we'll have her as well on the line. So, yeah, you know, we've already got a couple of presenters that couldn't make it this morning. You know, Councillor Hamilton?
Yeah?
Are you there? Oh, we thought you'd run away, you know.
No, I'm here, but the line is really bad.
Is it? You can hear me, though?
I can, just about.
Oh, just about. Okay. Thank you very much for taking time to join us. As I was talking, we've got Dr. Justin Varney in the studio as well from Birmingham City Council. And with everything that's going on, like I say, here at the studio, a couple of our presenters who were supposed to come to this show could not make it. And it looks like, you know, in general, where are we now?
Sure. So if I start off and give a bit of a picture and then ask Councillor Hamilton to give a bit of reflection about what Council's been doing. Mm-hmm. So obviously the situation's changing rapidly. We have over 90 cases of confirmed coronavirus in Birmingham, and we now sadly have several deaths as well. The situation is changing very fast. We are really moving into a space now where we're asking everyone to stay at home unless it's essential to go out. We need to keep that physical distance of 2 meters between us if we do go out, and we have to hand wash all the time and avoid touching our faces. And those are the core messages we're trying to get people to understand. But perhaps Councillor Hamilton, has been working with me closely over the last couple of weeks and months as we prepared for this, and I know she's been a real advocate, particularly for ensuring how we think about our vulnerable people and our elderly during this time. So, dear Councillor Hamilton, if you want to share some of your thoughts as well.
Is it over to me, Justin?
Yes.
Okay. Well, for me, Justin has been doing a sterling job because as a council, for a number of months, we knew this was coming. So what we've done is we've made preparations for this. We have had a group in place since about the end of January that have been working with Justin to ensure that we are looking at every aspect of what's going on. What I'd like to push out today is, as a council, what we've done is we've not just talked about social isolation and social distancing. What we've done, we've actually tried our utmost to practice it. So we've moved most of our workers that can be moved to working from home, working online, working through the telephone. We've also tried to get the messages out to the public that that have come from the government, that they're not to go to pubs, centres, gyms. They really need to take this social distancing really serious. But what I wanted to say this morning was about the elderly. Birmingham is a very young city, but we have got quite a lot of older people, and people seem to think out there that if you are young, you cannot get this condition, but that is not the case, and Justin can explain more about that. But what I wanted to say was about the older people. Many of them have been told for the last week that they need to socially isolate, so they need to be socially isolated for the next 12 weeks. This is going to become a big problem as the weeks go forward. One, many older people are in the home, they're on their own, they're worried about how will they get food, how will they do what they normally do, how will they socialise with other people because they are expected to stay at home. Well, the guidance so far is you can go out for little walks as long as you stay away from people. But what we're saying as a council is if you can socially isolate but support those people that are in the home. I have quite a vibrant older group in my ward, and the advice I've been trying to give across the city and in everything I'm saying is, one, just drop a little note through the door with your number if you know that someone is struggling, your next door neighbour. If you know their numbers, ring them. Family, communicate via the telephone. Friends, communicate via the telephone. If they need a little assistance with shopping, help them with that. We have got a wonderful system in the city through BVSC, where they are an umbrella organisation, where they're helping to coordinate a lot of this work, and Birmingham City Council is supporting them to do this. We have to work together. There are some phenomenal people out there. The health service are absolutely working to capacity at the moment. Social care, absolutely. People have been moved from their day jobs to help with what is going on with people out in the community. We have to support each other. But my big message, and Justin will keep enforcing this, is please take this seriously. As a community, many of us have, we've said, well, perhaps this isn't as serious as people are saying. Perhaps it's a conspiracy theory. Can I just say it is neither of those? This is a virus that, unfortunately, because it is so virulent, because it is so infectious, it is killing people out there. And if the direction of travel is true from what they've said about Italy, and Justin is the specialist, they say we are 2 weeks behind Italy. So I'm asking residents, keep yourself safe, practice social distancing, do the social isolation. If you get a cough or a high temperature, you must go into social isolation. If you're living in a family like myself, there are 6 of us in the house, you will go into isolation for 14 days. If you live on your own, they have said 7 days. Please practice these measures, because this is not a practice. We are in the middle of a crisis, and I will stop there.
Yes, and obviously, they've been reporting that the West Midlands has got some of the hotspots in terms of the virus. And just looking on social media, yesterday Dudley alone was trending because of a picture that was taken at one of the supermarkets where there's hundreds of people that have come. Is the council going to do something to combat that? There's a whole lot of us out there that are social distancing, that are staying at home. But for those people that are going out, like you say, that think, okay, there's not, it's a whole conspiracy or, XYZ, how are we going to combat those people?
So let's just be really clear. This is not a conspiracy. The difference for a city the size of Birmingham between whether we take action, all of us take responsibility or don't, is about 4,500 people dying. So if we don't take action, if people wander out, they go to parties, they sit around as large gatherings, have a barbecue together when the weather gets better, the risk is that we will see over 8,000 people die during this outbreak. If we take responsibility and act sensibly, if we wash our hands, we keep that physical distance of 2 meters, we can potentially save over 4,000 people that didn't need to die because of this virus. And just on the supermarkets point, I know there is working going on nationally with supermarkets to help some of the chaos that has happened. I just, on the way to the studio, passed the Lidl just around the corner from you. No queues, no chaos, people leaving and approaching more than 2 meters apart. Shelves didn't look spare. The vast majority of the city is acting sensibly, and what we know is, and this happened in Italy as well, when they were where we are now, exactly the same thing happened. Everyone rushed out. We bought like it was Christmas, and then a whole load of food got wasted. we just can't eat it that quickly. So please be sensible. Shop at different times during the day. You don't need to be there when the store opens. The shelves are being restocked throughout the day. Fortunately, there is toilet roll in the city, and there's not a shortage of baked beans either. So please be sensible and be practical. Try not to go in the times that are reserved for older people or for NHS staff. It's really important, and I'm really pleased supermarkets are separating those two time slots as well, because we don't really want those two groups of people mixing. If you're working from home, it's a bit easier to go shopping in the middle of the day now. Obviously balancing your childcare as well, but please be sensible. Shop local. The local corner stores tend to have everything in, and they're a lot less chaotic than some of the big supermarkets. And don't get sucked into the media hype on this as well.
Yeah, and you're talking about families, where you've got a family of probably 6 or more that live together in a short space. Is the city council putting any provisions in terms of, if one of the family members gets ill and they need to self-quarantine by themselves, where they could go elsewhere?
So it's important to understand the guidance that we have on this. If someone in the household has symptoms, the entire household is locked down. Okay, this is not, we've passed the point where you take people out of the home, and that's because increasingly we're understanding that there may be a short period of time before you have symptoms where you're infectious, and the people that you live at home with, you're going to be spending that time. So this takes more than about 15 minutes to spread, and it's that close contact of less than 2 meters apart. So pretty much if you've got it, everyone in your household is likely to be exposed, and that's why the whole household goes into isolation for 14 days. Anyone who develops symptoms, they start a 7-day countdown. If it's within the 14 days, they stay for the 14 days. But if it's on day 13, they've got to stay in for another 7 days. After 7 days of symptoms, you're no longer considered to be a high risk. So the person who started can go out and do the shopping after the first 7 days or go and get medicines. But it's really important the whole house goes into lockdown. If you're lucky enough to have multiple bathrooms, then my advice is that whoever's got the symptoms, they get their own bathroom. Sorry to everyone else in the household. If you're not, then it's important to clean down bathrooms. Similarly, most of us only have one kitchen, so that it designate someone to do the cooking, not the person who's got symptoms. And if mum's sick, then sorry dad, you're going to have to learn to cook. But it's really important that we try and separate out, where you're sitting around watching TV, the person who has symptoms should be on one side of the room and everyone else on the other. Try and keep that distance. There'll be some lovely stories of kids who've become coronavirus superheroes and building little cushion forts between their parents to keep them 2 meters apart. So do get the kids involved in helping to stick by the rules.
Yes, and Councillor Hamilton, is there anything else you want to tell our listeners, our community?
What I'd like our community to do, I'm just going to reinforce some of what Justin has said. They mustn't panic, but they must keep an awareness of what's going on. Birmingham City Council is getting the guidance from the government on a daily basis. Justin is involved in regular meetings with Public Health England and with the NHS, both locally and nationally. We are doing a great deal of work with the West Midlands Combined Authority. This is not a political thing. It is all the parties coming together. It's about officers working together across these different bodies, and it's about us ensuring that the community we serve fully understand what we're asking of them. I truly believe that the government at this moment in time, many people have said they've been slow. I believe they've tried to give us the opportunity to do what we need, what they've asked us to do. I think things will ramp up in the next 3 to 4 days. That is my personal view, but I'm saying to the community, please take this seriously. The measures are there for a reason. And people, if you don't understand, e.g., if you are in 0-hour contract jobs and you don't understand what is happening about your wages. I know that Birmingham online service, as we get things, we are pushing it out. And we're trying to put it through the website. I've been sending it to everybody I know, but I'm hoping the networks will get bigger and bigger. So I'm hoping Justin will make sure that you guys at New Style get all this information we're talking about, and you can ask your listeners to actually go online and see what's going on. If you can't go online, the television programs, and you watch the television, it's on every single station, it's on every single program. They are absolutely pushing the information out there. Listen to what's being said, take advantage of the advice, and please practice social distancing and, if at all possible, social isolation in your home wherever possible, that you can do the work that you need to do and continue doing the work you need to do, and you're not putting yourselves in harm's way.
And that includes the churches as well?
I didn't hear that. What did you just say?
Our churches.
Well, the churches at the moment, they have been behaving really responsibly, because they had a meeting last week, or I don't know if it was online or virtual, I'm not sure how the meeting was held, but they decided to close all the churches on Sunday, and a number of them had put the church services online. I'm not sure when they plan to open again, but I don't think they are, because they are worried that a lot of their congregation are over 65 years old. So there is that concern there. So they have made the decision to close. Secondly, I believe the churches are discussing at the moment about some of the big funerals we have in our community and how that will be managed going forward. I don't know the outcomes of that, but can I say to residents, we have funerals of 1,500, 2,000 people. We cannot be congregating at funerals of that size at this time. We know that people, we're there, we celebrate life. That is the thing we do normally as a community, and I absolutely respect that, and I'm there whenever I know someone that's passed away and I can get to the funeral. But now is not the time to be congregating at these massive funerals, and Justin might be able to give you the guidance, but I think the government has said no more than 50 people, is it Justin, or 10?
So
I'm not sure.
Yeah, I think we're now going down to more like no more than 5.
Right.
And I think Germany went down to no more than 2. So, this is the kind of approach we need to be taking outside of the household. No more than 2 or 3 people coming together, and they have to be more than 2 meters apart. We have to learn to honour our dead in a different way across every faith and every religion at the moment. It's going to take some change, but those that have passed would want us to live and live safely.
Yeah, and as we move forward, obviously we're taking care of the elderly and those with health conditions who are more vulnerable. Now, what is it in particular with the sickle cell?
Sure, so I'm glad you asked that. So sickle cell disease obviously affects the Afro-Caribbean community more than other communities. So a couple of things to say. If you are living with sickle cell disease or sickle cell trait, look after yourself, listen to the advice, keep that physical distance. You are more vulnerable than someone that doesn't have sickle cell or sickle cell trait. There isn't additional advice unless you've had your spleen removed. So some people with sickle cell disease will have had their spleen taken out. They know who they are. They will probably fall into the group that are considered most vulnerable, and they may well get a letter from the NHS over the next day or two, and that will really advise them to go into more extreme and serious self-isolation for the next 12 weeks. And that's because people who don't have a spleen, their immune system's not as strong. Okay. But for everyone else, keep hydrated. Keep on with all the things that you should be doing for your sickle to keep yourself healthy. If you do have pain, then go through your normal protocol. What I would say though is if you have a temperature, and you have pain, then please contact 111 before you go to accident emergency or before you go to your GP. Really important, those two symptoms of either a high temperature or a continuous cough. If you have either of those two symptoms, stay at home, go on the 111 website and follow the advice that it gives you.
Thank you very much, Dr. Justin Viney from Birmingham City Council. And Councillor Hamilton,
Yes.
thank you very much for joining us this morning. Apart from what we've talked about, obviously the washing of the hands, and the social distancing, anything else that you'd like to add on to that?
Well, we've talked about washing of hands, but I'm going to stress that point now. It's not just washing your hands, it's washing your hands for 20 seconds. It's ensuring that you wash between your fingers, that you wash the tips of your fingers as well as the back of your hands. You need to wash your hands regularly. I always say to people, you need to wash your hands at least every hour. But Justin may have other guidance that has come forward. But I always say to people, at least once an hour, wash your hands. Make sure that any hard surfaces, you wipe them regularly that you're using so that things are kept clean around you. And just make sure, and I'll just emphasize what Justin has said, keep yourself safe. We will get through this. We will get the vaccine that we need for this condition, but at the moment we haven't got the vaccine. It hasn't been developed yet, and as a country, as communities, we are all in the same boat at this moment in time. What I don't want is for us to end up like Italy with the death toll rising. So I just want people to just take the precautions now that will help us as we go forward, and to take this condition, this virus seriously. I'm not saying to panic. I'm saying just take it seriously and just adjust certain things you were doing before. Just adjust it in your life so that things like shaking of hands and kissing each other, and we can't do that anymore. In the community, they've now put out videos, I don't know if you've seen them, of little dances where people show you what to do with knocking of feet and your elbows. Just do things in a different way and we will get through this. But I was just really keen for Justin and myself to be here today to just say, Birmingham City Council, we're working with the communities, we're working together because we want everybody to remain safe and we want to ensure that the messages are out there. Thank you.
Thank you very much. Thank you very much for joining me this morning. And the germs, the everyday germs out there, is there anything that we can do about it?
So I think it's important to keep in mind when you're out and about, be conscious of not touching your face. Wash your hands before you touch your face. I know as gyms across the city close, there's been queues lining up at the outdoor gyms, and that's great to see. But take a packet of those wipes with you, the kind of cleaning wipes. Wipe down the gym equipment before you use it, preferably after you use it as well, because otherwise we'll just hand it on the germs to each other. The other key messages to get across are soap is better than hand sanitizer. So if nothing else, carry a bar of soap wrapped up in some cling film and a bottle of water. It's just like camping. Just wash your hands wherever you can. It doesn't matter. A bit of soap on the floor won't kill anyone, but it will kill the germs. If you are getting hand sanitizers, please ensure it's got 60% alcohol. There is too much snake oil being sold.
Okay.
Right? Really important you don't get conned. If it hasn't got 60% alcohol, it just won't work. So, for this particular virus, its coat is fatty, so things like washing up liquid will kill it, and soap is by far the best thing that knocks it out. As Councillor Hamilton said, we are all going to have to learn to live our lives differently. And whether you say hello with a Vulcan salute or a Wakandan chest grab, whatever it is that works for you, I don't care. Just don't touch each other. This is going to go on for months. and it's really important people understand that the steps that we take today will make the difference between whether thousands die or hundreds die, and that's so important that we all own that and own that responsibility, that we help get young people into this space. So sadly yesterday we had the first 18-year-old pass away in the UK. So it was a young person who had health conditions, but it's a real reminder to us all that this is not just a disease that affects older people. This is a disease that can affect young people, particularly young people with other health conditions, and we've all got a responsibility to act, because this is our city and we need to come through this, and the way we do that is by all of us taking action.
Indeed, and people staying at home at the moment.
Yeah, this is the time to catch up on all your Netflix binges, whatever else you're into. Listen to the radio. You know, I hope that one of the good things that come out of this is people will rediscover radio.
I hope so.
Yeah.
Hey, hello.
You've got people like Fresh who are going to keep you amused and going through the coming weeks and months. And actually, you know, it's also a time to reconnect with family. You know, many of you today will have children at home that should have been at school. By keeping at home, you're not just keeping them safe, you're keeping your household safe. Don't feel too stressed about that. It's going to take a little while to get in the routine, and you know, there's some really good advice on websites like the BBC about how to have the conversation with kids, and lots of the schools are producing resources to help you. It's going to take a little while to get in the rhythm, but you'll get there. And you know, all of us are doing the best we can. Don't beat yourself up, just out of responsibility. Stay at home. Time to get those board games out, start to build a routine, and the other key message is don't spend your day in your pajamas. You know, it's really important.
A lot of us are at this present moment. It's like, I can't
many
be
people
bothered.
are. You got to get up, get dressed, do a bit of exercise, schedule your day, and really stick to that schedule. That will also really help the children.
Absolutely, and some of us, you know, ever since the cleaning of the hands, we're becoming OCD in terms of everything, the door handles, the knobs, it's like that. And you know, I just, you know, people social distancing and washing of hands. I've got to say thank you very much to my guests today, Councillor Hamilton and Dr. Justin Varney. Thank you very much, and hopefully we'll have you back again sometime soon to come for more updates.
I absolutely have to. Both of us, I'm sure, and you know, Councillor Hamilton's already working from home. I'm moving to do that at pace this week as well.
It will be on the phone, isn't it?
So it'll be on the phone.
We have to exercise this social distancing. But thank you very much. Like you say, to you going on isolation, isn't it? Yeah. I should tell the boss I should go on isolation too, isn't it? Yeah. Anyway, thank you very much for joining me. There you have it. It's just gone 11 o'clock. New Star Radio 98.7 FM. You've heard it, guys. Stay at home and wash those hands with soap. You know, I know a lot of you guys are buying the hand sanitizer. You know, I've always believed in soap and water. Soap and water, you can't beat that.
On air, online, and on your radio dial, 98.7.